Hey everyone, we're live here with Timmons Group. I'm Lillian Minix. I'm a marketing coordinator here at the firm. We are sitting down today to talk with Rosa and Andrea Korman of the Pennsylvania Game Commission, just to get a little bit more information about what kinds of projects they're working on. Andrew is a data scientist here at Timmons Group, and Andrea is a biologist with the Pennsylvania Game Commission. Thank you guys for joining me today.
Yeah, thanks for
Thank you for having us.
Yeah, really exciting stuff. Andrew, do you want to introduce yourself?
Yeah, I guess so. Well, I'm Andrew Rosa. I'm a data scientist with Timmons. I've been with the company for about 2 years now, and in that time, I've focused on helping our clients get more valuable insights out of their data by doing data analysis and building things like dashboards, which we'll be showing off today.
That's fantastic. Very, very nice to have you here today with me, Andrew. And Andrea, tell us a little bit about your role at the Pennsylvania Game Commission.
Sure. So I'm actually the chronic wasting disease biologist for the Game Commission. I've been here almost 2 years, but prior to this, I got my master's in zoology in Oklahoma. And then after that, I spent about 10 years working in the wildlife biology field for different agencies like the U.S. Fish and Wildlife Service and the Forest Service on all different species around the country. But here I focus strictly on chronic wasting disease and trying to manage this disease in our wild deer population.
Fantastic. Well, again, thank you for being here with me today. Really excited to touch base on this new dashboard and what you all have been working on, because it's a really great example of the kind of geospatial technology work that we do at Timmons Group, working directly with a municipality or with a commission like Pennsylvania Game Commission. And it's a really important piece of what we do because it's very applicable and tangible to the community at large. And so it's really exciting stuff. Can you give me, Andrea, just like a 2-minute overview of the project and what kind of solution it's providing for your work?
Sure. So we were constantly, and understandably so, getting questions from the public on our chronic wasting disease or CWD surveillance that we do. How many samples have you tested so far? How many were positive? Are there any detections near where I live or where I hunt? And so it became clear to us that we needed some way to give the public up-to-date information on where we are with surveillance and what's happening in their area of interest. And not only that, a lot of our staff, it was hard to get this information to them as much as they needed it. And so, people like our game wardens who are out in the field and interacting with the public are getting all of these questions, and they didn't feel like they were always able to answer them. And so we needed something that was easily accessible for our staff as well. And so we started working with Timmons on, developing something that we could display our data in an easy to understand kind of interactive manner, both for the sake of our agency and keeping our employees up to date, but also for the public to help increase their understanding of what was going on.
Absolutely. That's a fantastic overview of why the new program and the new tableau is so important. Let's do a little bit of a backtrack. And for those joining us today that are not really sure what chronic wasting disease is, can you give us an overview of what that disease is and why it's so important to the white-tailed deer population in Pennsylvania?
Absolutely. So basically, chronic wasting disease is a disease that affects members of the deer family. And in Pennsylvania, we have both white-tailed deer and elk that are susceptible to this disease. It is always fatal, and it is a neurological disease. It's actually caused by a prion, which is a misfolded infectious type of protein. So they can transmit it either to each other through infected saliva, urine, or feces, or even through contaminated environment. And one of the reasons it's really important is that research has shown there is potential, at least in a lab setting, for it to cross the species barrier into, swine and non-human primates. It's able to remain infectious in the soil for years. It can contaminate water sources. It can pass through the digestive tract of scavengers and predators. And currently there is no vaccine, no cure, no treatment of any kind. So as the agency responsible for managing this wildlife population, it's our duty to try to limit exposure to this disease that has so many unknowns and basically no cure. So that's kind of a super quick rundown of CWD and what it is and why we're so focused on trying to manage it.
Absolutely. That it sounds like a rather significant part of the wildlife population in Pennsylvania, and honestly across the entire United States. So it's really exciting stuff to see that what we're doing here in Pennsylvania with Timmons Group and the Game Commission is pretty applicable in the future for other places potentially. So, you know, opening a lot of doors with these dashboards. I'm going to ask Andrea and Andrew, you know, what collectively Timmons Group's role has been in the tableau, and then also the Game Commission's role. And I know we're going to get into the nitty gritty, and we'll take a look at it here in a few minutes as well.
Yeah, I can sort of answer some of that first. You know, for us at Timmons, our role was really building the dashboard using Tableau. So it was a very iterative process, going back and forth with people like Andrea, PGC, getting data from them, reviewing the data visualizations and make sure that they actually work for them and have meaningful insights for them.
And as you know, as far as what our role was, it was kind of coming up with the ideas of how do we display all of these data. You know, normally I'm looking at it in an Excel file, and how do we make this into something that's interactive in a way that people can interpret what this means? Okay, so we collected 12,000 samples and, you know, 200 were positive. What does that mean in the grand scape of Pennsylvania? You know, and coming up with which maps are going to be the most informative. And if I were a member of the public and I wanted to look at these data, you know, what specifically is it that I would be interested in, and being able to find a way to kind of tell that story. And, you know, finding a way to also format our data in a way that it can talk to the Tableau program and be able to display the data in the way that we want as well. So it was a lot of us coming up with ideas and talking with Andrew and Timmons and what was feasible and what wasn't, and trying to figure out the best way to get this up and available for the public.
Absolutely. It sounds like there were a lot of working parts, you know, on both ends to get this tool up and running. You know, I know that we were also going to talk about some challenges that were associated with the project, but I'm wondering, Andrea, before we get to that point, if you'd like to share your screen and kind of walk us through what the Tableau looks like.
Sure. So, can you see it?
Yes, we can.
Okay, perfect. Okay, so this is kind of what the screen defaults to whenever you log on to our page for our CWD surveillance. We did create, well, Timmons created these 3 different tabs at the top. And so, you know, we wanted to provide a basic, easy to understand graph of what we've done in terms of sampling and positives per season. And so we started with our sampling back in 2013. We did start testing prior to that, but this was when we got our initial detections, and also when we started having a more consistent way of recording our data. And so these were all the most accurate data sets that we had to work with. So these all just give you a summary of how many samples were collected in any given season, and then how many samples were CWD positive in each of those seasons as well. And for the sample prevalence, you know, this is where it's really interactive. People can really narrow down what it is they want to look at, and gives you all of these different filters you can use. You know, you have your adult yearling fawn categories, and we even break it down into hunter harvested versus roadkill and some of the other types of samples we collect. And you can look at male versus female data. Some of this may be only interesting to agency people who are working on the management side, but the public also has the option to kind of filter through all those things as well. And then we have all the different maps for them to choose from, whether they want to see, sampling in our disease management areas, or they can go even down to the township level of, wherever it is that they live or they hunt, and they want to see how many samples were collected this season or the previous season. And then some of these other ones we actually use more internally as well to track our goals and objectives. I'm not sure if you want me to go into all that yet.
I think that's fine.
Okay. So
keep rolling with it.
Okay, awesome. So, from an agency standpoint, we have used this in addition to providing it as kind of a public resource. We have used it for some of our own kind of determining different management actions we want to take. So for example, this township one, if I was just a member of the public, I would certainly use this to see what's going on around the area where I hunt. How many positives there have been. But in this particular case, what we did was we were starting to get a clump of positive detections kind of in this area. And we were curious if we should consider bumping our disease management area east of the river, because we know deer have the ability to cross the river. We were viewing it as a barrier, but we know it's an impermeable barrier. And so we were curious, just how much have we been sampling east of the river? And is it enough to give us confidence to say, we don't think CWD is over here. We don't need to push the disease management area boundary. And when we looked at these different townships, Lower Augusta, we had 2 samples. And in Lower Mahaney, we had 8. In Jordan, we had another 8. And then, West Cameron, we only had 3. And so that really showed us we don't have significant enough sampling to confidently say it's not there. And that helped us decide to push that boundary. Another one of the maps that we use pretty frequently is we have some of these higher priority areas. And now I'm looking at last season because we have a complete data set for it. But these were some high priority areas where we had a detection that was pretty far away from other detections. And in those areas, we actually have a target sample size we want to hit. And so this actually, the way Timmons set this up is you can see what our sample size goal is, how far we have to go to reach that goal, and how many samples total were tested. And so in this particular unit, we went pretty well above the 250 that we were targeting. And this helps us track our progress throughout the season to see, if we're meeting those targets or not. Another one is in our response plan, our objective is to keep this sample prevalence at or below 5% in what's called our established area. Now, you do have to click on it to get these numbers to change. But this is another one of those where we can track throughout the season if we're meeting that target or not. Now, in our response plan, it actually specifies sample prevalence in adult hunter-harvested deer. And so I can even filter for those adult and then the hunter-harvested to see what it was in that specific sample type. Clearly, we were not at our 5% objective, but it also allows me to track it over time in each season as well. And you can see there was a huge jump between 2019 and 2020. So this is super useful, not just for transparency to the public, but also helping us track our goals over time and within each season. And then just to show you this last tab, gives us some of the sample statistics, just more visual breakdown of the numbers for the different sample types. And if people were interested in where those other samples are coming from, it actually shows you the breakdown of those as well. So we have some that were clinical suspect deer, so the ones that were actually looked sick when they were tested, permitted deer, some that were from not last season, but this season it would be from targeted removal, and all of those different sample types. So hopefully that gives you a good overview of what this dashboard is and what some of the capabilities are.
Yeah, I always love hearing when you guys talk about how you use this in your operations. It always gives me some ideas of how we could expand on this dashboard and sort of where to take it in new projects going further. You brought up looking at areas of where it starts to cluster, where you start to see a big uptick in CWD cases, and then trying to find visually, where you might not be doing as much sampling. I think that is an opportunity right there to bring in some sort of automation, and even some sort of more data science predictive analytics or prescriptive analytic to say, hey, here's a cluster popping up. Maybe we should look at these counties right here or these towns that border them right here.
Yeah, absolutely.
That's just fantastic. I mean, it's such a tangible example of the work that we do at Timmons Group and our geospatial. All of the folks up there that are kind of keeping everything running behind the scenes for a lot of programs like yours, Andrea. It's really neat to see it in the right hands and see the potential behind it as well. I know, and the next thing that we were going to chat about is some of the challenges that were presented. Andrew, I'm curious to hear about the challenges that you and your team had when developing this dashboard.
I think a lot of the challenges come from the type of technology that we use to build this dashboard. We use Tableau for this. We do a lot of sort of custom application here at Timmons, but with Tableau, it's less custom. It's much more GUI based. And the advantage to that is it allows us to iterate fast and build these sort of dashboards very quickly. The drawback to that, though, is that you sometimes have a harder time creating a bunch of the maps that you're looking to create. And again, some of the sort of filter functionality that you're looking to do. There's only so many layers that you're allowed to put on these maps. So you end up breaking them out into multiple kinds of maps, and then just making sure that all the data links up correctly so that the filters work correctly can always be a big challenge.
Yeah, and so when you're talking about being able to create the maps, but kind of in a more peculiar way, are you able to add like can you create a map like outside of Tableau and then bring that in, or are you kind of limited in that way as well?
You're very limited in that way as well. You are luckily able to bring in point data, which is what you kind of see right there with that density map, as well as custom boundaries you're able to bring in. And so you can see those custom DMA boundaries that we brought in on that map as well. So you can bring in a couple layers, but it can be very hard to match up data-wise those layers and making sure that the filters work correctly.
And that's a more technical side of a challenge on the back end of the dashboard. Andrea, what are some of the challenges that you've run into on the back end of your work in the project?
Well, kind of like he said, figuring out what some of the limitations are and what you can do to compromise to still get what your ultimate goal is. And then I think a little bit of what we've struggled with here and there is just the way we enter our data and making sure that it's getting picked up by Tableau and displaying on these maps. I think it was recently, most of our positive detections come from a sample we collected from the lymph nodes. And then we had one that was connected or collected from the obex, which is the brainstem. And so it was entered differently because it wasn't a lymph node sample. And we couldn't figure out why our total detection number wasn't matching what was in our data set. And it turned out it was because some way that we had entered it wasn't the way Tableau was picking it up. And so just kind of troubleshooting some of those, little tweaks of how we enter it versus how it's picked up by the Tableau program, and working through that stuff and just making sure that our numbers are matching, and being able to do that.
Yeah, data quality is always, a big challenge, especially, when it comes to data collection part of it, and then bringing it into these dashboards, making sure all the terms are correctly, the formulas are correct and everything. So it's always a back and forth iterative process, talking on the phone with the game commission people and, troubleshooting with them and then troubleshooting on our side and picking up where the bug actually lives.
Yeah, and you want that data to be accurate and correct, not only for the viability of the program, but also this is something that both of you are really passionate about on two different ends of the spectrum. Andrew, you told me a little bit of a story about why this is such a fascinating and passionate topic for you. Do you want to expand on that at all?
Yeah, well, so I grew up hunting. Hunting is a very big part of my dad's side of the family. It's just a tradition that we all hold pretty dear to us, especially when it comes to hunting white-tailed deer. And I grew up only about an hour away from the Pennsylvania-New York border. So, doing something like this helps me feel like I'm contributing to wildlife conservation and hopefully to the health of being able to continue hunting, up in the Catskills, which is really quite close to Pennsylvania.
Yeah, absolutely. And it's really, I want to keep going back to the fact that Timmons Group works on projects like this one, and we've got our arms in so many different parts of wildlife, forestry, wildfire, everything, and geospatial wise, and we really are making a larger difference for the impact of the environment, for the health of the environment, and it's really neat to see that you get to work on a project like this that also directly impacts your extracurricular activities, and your passions outside of work too. So I just think that that's a really neat part of our story. Andrea, I would also like to ask you the same question. Well, maybe a different branch of the question. What has been one of your favorite parts to work on for this project?
I think kind of the neatest part of developing this dashboard is just seeing, that bland Excel file with thousands of lines of data points turn into something more of a story that, I can go back and look at different seasons, and, you'll be surprised looking at just last season where we were with detections and what it looked like, and being able to go back to all of those previous seasons. You can see this kind of mess in the south central part of the state, and you can go back and see how that has grown, and just looking at an Excel file really doesn't tell you that. And so it was kind of exciting to me to give the public something so that they understand. A lot of people I hear all the time, well, I don't see any sick deer out there, so how serious can this be? And if you look at this map and you see, especially this detection density, it looks pretty serious to me. And I'd be pretty concerned if I were a hunter hunting in that area, and I would certainly be getting my deer tested because, that's kind of scary in that area. And I think this helps really tell people this is spreading. This is a problem. If we don't do something now, it's going to be too late. And I think putting it into this kind of display is something that really helps get our message across. And that was just, really exciting to develop something like that.
Absolutely, making a larger impact. And I forgot to ask you this earlier. I meant to ask a little bit sooner in our discussion. Is this something that the public can access, this dashboard, or is it for internal folks?
Oh no, this is available on our website. If you go to our main CWD page, it's also on the page with where hunters can look up their testing results. So if you just go on our main CWD page, there'll be a link. I think it says CWD testing results and surveillance data. And that'll take you to this web page, and anybody can access it.
That's fantastic. And I'll be sure to put that link at the final post for our discussion as well, so that folks can take a look at it. Because I think, it's really important not for us to just be able to talk about it like this, but for people to be able to interact with it. So that's really neat. Absolutely. So let me move in, kind of wrapping up direction. Will we see other projects like this in the pipeline? I mean, what are your plans with this, Andrew?
Yeah, so we have also been working with the Game Commission on the Wildlife Health Database, which is sort of linked to this in that helps collect the data, and part of the data that will feed into this dashboard, which also just kind of helps with data quality and all that sort of things. We've also have a project that we are currently sort of in a discovery phase with people at University of Pennsylvania Wildlife Health or Wild Futures for a very similar wildlife health collection application. And the Game Commission has a very important role into that as well.
And to also kind of add to that, we also we presented this once it was completed to the Pennsylvania Department of Agriculture, because they oversee the captive cervid industry. And so, we deal with the free ranging deer, and they deal with the deer behind the fence. And they have also had CWD detections in their farm deer. And so they really liked what we did here. We worked with them and Timmons to help them develop a dashboard as well, so that the public can see what's going on, kind of in the business side of CWD and where some of these positive facilities have been located, because those data aren't shown on our map because that's not our agency, but it's the same disease and the same species. And so we've been working hard to kind of work together a little bit better to really tell the story of what's going on, because it's all connected in some way. And so we were able to bring them in as well, and Timmons helped create them a pretty neat dashboard too.
Yeah, and by linking both of those sort of data sets up together, you're telling the whole story around CWD within Pennsylvania, not just one area of it.
Absolutely. Growing in a larger way as well. Wow. This has been an absolutely fantastic conversation. I really appreciate both of you sitting down with me today. Andrew Rosa from Timmons Group and Andrea Korman with the Pennsylvania Game Commission. Is there anything else that you'd like to share with anyone watching with us today before we call it a day? All right.
No, I think that's it.
That's a fantastic conversation. Yeah, absolutely. Well, everyone stay tuned. We'll be including that link in the final post for the discussion today. We appreciate you all joining us.
Thanks.
All right. Take care, everyone. Thank you.